Hello, I'm a doctor with over 30 years of experience. Subscribe to my channel and ask your questions. I'll be here to share valuable medical knowledge with you. Chronic obstructive pulmonary disease, or COPD, is a long-term lung disease that makes it hard to breathe and gradually worsens over time. The condition is mainly caused by exposure to harmful particles that damage the lungs, and in the United States, the biggest culprit is cigarette smoking. In fact, smoking is responsible for up to 70% of all COPD cases. Other causes include long-term exposure to air pollution, chemical fumes, or dust. In rare cases, genetics, especially a condition called alpha-1 antitrypsin deficiency, can increase the risk. In healthy lungs, the airways carry oxygen smoothly in and out, but in COPD, two main problems develop. First, the air sacs in the lungs lose their natural elasticity, so air gets trapped inside and it becomes harder to exhale. Second, the airways themselves become swollen, narrowed, and filled with mucus. Together, these changes block airflow, making every breath more difficult. The most common symptoms are shortness of breath, especially during physical activity, a persistent cough that may produce mucus, wheezing, fatigue, and frequent chest infections. At first, symptoms may be mild, but over the years they worsen, and some people struggle to breathe even while resting. Many patients also experience weight loss, chest tightness, or recurring lung infections that make the disease progress even faster. COPD is a major health problem in the US and is one of the leading causes of disability and death. Unfortunately, it is often diagnosed late because people mistake early signs for normal aging or smoker's cough. That is why awareness is critical. Catching the disease early can make a huge difference. While there is no permanent cure for COPD, there are effective ways to slow its progression and improve quality of life. The single most important step is to quit smoking. This alone can dramatically reduce further lung damage and extend life expectancy. Avoiding secondhand smoke, polluted air, or workplace chemicals is equally important. Medical treatments usually start with inhalers that open up the airways and make breathing easier. Depending on severity, doctors may prescribe short-acting or long-acting bronchodilators, and sometimes inhaled steroids if there is frequent inflammation. Pulmonary rehabilitation programs, which combine exercise, breathing training, nutrition, and education, are proven to help patients breathe better and stay active. Vaccinations against flu, pneumonia, and COVID-19 are also strongly recommended to prevent infections that can trigger dangerous flare-ups. In advanced stages, some patients may require oxygen therapy or even surgery, such as lung volume reduction or transplant. Living with COPD can be challenging, but with the right approach, many patients continue to live fulfilling lives. The key is recognizing the early warning signs, taking lifestyle changes seriously, and working closely with healthcare providers to stay on top of treatment. The bottom line is this: COPD is preventable in most cases. Quitting smoking, avoiding harmful exposures, and seeking medical care early are the most powerful tools to protect your lungs and your future.